A K-State veterinarian embodies both a human and an animal spirit, and here at the College of Veterinary Medicine, our faculty practice what they teach. Every day is different, presenting new challenges as we care for our closest animal friends and establish nutrition, health, and wellness protocols that protect not just our animals, but also the health and livelihoods of humans. We seek to gain the trust of our animals and in turn, gain not only your trust, but your hearts. This is our K state of mind.
My name is Dr. Leslie Wagner. I have been at Kansas State University for the last year, and I've been a veterinarian since 2015, so coming up on 5 years.
My name's Shaun Huser, and I'm a field service clinician here at Kansas State University College of Vet Med. I've been here 3 years. This will be my 4th year with the university. We're at Holy Goat Dairy. It's a goat dairy that's just north of Manhattan. Now today we're administering copper boluses to all of Dr. Bennett's does. We've had some of the goats out here be diagnosed with low copper levels, so we have some concern about the copper levels in the rest of the does and in this herd, and so we're administering copper boluses to supplement the copper levels that's already present in their feed. You take the balling gun, slide it over the base of the tongue, and you're going to feel there's going to be resistance as it's sliding over the tongue, and once you get to the pharynx, you're going to feel a sudden decrease in that resistance.
My name is Suzanne Bennett. I'm a retired OBGYN physician, and this is Holy Goat Creamery. We started this facility 3 years ago. We have 2 Irish Wolfhounds and 2 exotic cats and numerous other animals. And so I went to the vet school, and the experience has been wonderful. So I started a relationship here with the livestock services, and they had not done much with dairy goats. And so it's been a wonderful relationship. They learned from my goats, I learned from them. Shaun had experience with dairy goats from another past experience. So he's been a lot of fun to work with. And he's the one I have most contact on in the field. The 2 that were before him, I had really good relationships with, and it was like losing part of the family when they moved on. So now Shaun's new family, and the residents have been fantastic.
So today we're at the purebred beef unit. This is the Kansas State purebred beef unit that they have for animal sciences and industries. Here we are keeping our junior surgery cows. So we have 20 cows here that we have bred, that are hopefully bred, that will be used as part of a teaching class. So today what we are doing, they should be about 3 to 4 months along, and we're going to be palpating them to see if we can feel any babies, feel their pregnancies. We're also going to put the ultrasound on them, so a sonogram of sorts, to see if we can ultrasound or sonogram the babies as well. And the ultrasound really helps us. When we palpate, there are certain signs, positive signs of pregnancy. One is the presence of a fetus, and so particularly when they get out, past a couple of months, so by 3 months you should be able to kind of pat around and that fetus will bump back at your hand. But then as they get even larger, you can just feel fetal feet, or sometimes the crown or the rump.
All right, guys, so today we're going to go through all these cattle. We're going to pregnancy check them, and we want to get really accurate dates on these because it's really important that the owner of these cows knows exactly, or as close to exact, as the time that they're going to calve. And so we're going to use the ultrasound today to take measurements so that we can get very accurate dates. We're also going to immunize them, and we haven't had a chance in the hospital to talk about immunization programs for cattle. This is an ideal time. They've already received vaccines for infectious causes of abortion prior to breeding. And so basically, this is boostering. The 2 that we're really concerned about boostering, or the one I'm really concerned about boostering, is leptospirosis.
She was bred May 2nd, so she should be around the 3-month mark, so you should start to see placentomes. So fluid usually indicates that there's probably a pregnancy, but it's not a positive indicator of pregnancy. So far we haven't seen any fetuses and we haven't seen any placentomes, which we would need to call her 100% sure she's pregnant.
Where we're at today is Hildebrand's Dairy in Junction City, or just outside of Junction City. And what we just did was we took a look at a young heifer that's about a year of age. That's started off, she was found lame last week. The owners treated her with some medication. They saw some pretty nice improvements, and then she suddenly slid down again this week. Upon further examination, we found an abscess in one of her toes. And maybe this is the whole story, maybe it's just part of the story, but when probing this abscess, and typically with an abscess we want to open it completely to allow it to drain, but this abscess, I kept finding that it was encompassing more and more of the sole of that foot, and so it'd be best to bring her into the hospital, put her on a chute that can actually tilt her on her side, then we can administer some medication to numb that foot so that we can open it properly and then check and make sure that the bone's not affected by the infection. I'd like one of you to take a listen, heart and lungs, at least on this side. I'll hold her over. We need to get a temperature on her. Take a listen to her rumen.
My name is Melissa Hildebrand Reed, and we are at Hildebrand Farms Dairy. I'm the operations manager and daughter-in-chief at the farm. I'm 4th generation dairy farmer. We've been farming since 1930 on this land. We're the only fluid milk processor in the state of Kansas on a micro scale right now. When it comes to our partnership with the College of Veterinary Medicine, it's definitely my #1 go-to, and Shaun is my guy. I mean, I love the opportunity to be able to learn from them and grow in my skills of, diagnosing, understanding, and taking care of these girls, because they take care of us, right? We have to do everything we can to keep them healthy and well, especially on days where it's 100 degrees out.
So what we did today was we put a wooden block on her good toe to help relieve some of that pain. Hopefully that'll help. Administer some antibiotic. We're going to put her on an oral anti-inflammatory, and hopefully the owner will be able to get her into the hospital in the next couple days.
I grew up raising goats and horses and cattle and showing them for 4-H. I also grew up as part of a ranching and farming family. And so being a part of that ranching community, I really wanted to give back. And so a big part of my job here as a food animal field services clinician is going out, reaching into the community, reaching out to agriculture, and helping producers make their operations the most efficient that they can be. I decided to become a veterinarian because I love animals, obviously, but I really love agriculture. And so it's part of the reason why I've decided to become a food animal veterinarian in particular.